All right, let's play detective today. We're going to grab our virtual magnifying glass and step right into the world of medical imaging. Our mission? To solve a super common and often really painful medical mystery. So how do you do it? How do you solve a mystery that's happening deep inside the human body without ever making an incision? Well, the answer is you use sound waves. We're about to see how doctors can literally look inside the body, piece together all the clues, and crack the case, all non-invasively. It's a pretty amazing process of deduction. And our case today, the whole investigation, it starts with this small, kind of unassuming organ that's in some serious trouble. We're talking about the gallbladder. Now our mystery, it has a name, Acute Cholecystitis. And basically, this just means the gallbladder has suddenly gotten really inflamed. The usual culprit? A tiny gallstone gets stuck and blocks the only way out. So all this bile gets trapped inside, pressure starts to build, and the whole organ just gets angry, irritated, and swollen. So we have a suspect, right? But how do we prove it? Well, we turn to our #1 tool for this kind of investigation, the ultrasound. And there's a reason it's called the gold standard for this. It gives us this perfect real-time window into exactly what's going on. Okay, so like any good detective, we're going to start by looking for the most obvious signs of a struggle. And believe me, in this case, the gallbladder is sending out some very clear distress signals. Our first major clue is just the sheer size of it. A blocked gallbladder basically swelled up like a water balloon that's about to pop. On the ultrasound, we're looking for some very specific measurements. If it's gotten bigger than 10 centimeters long and 4 centimeters wide, that's a huge red flag. This extreme swelling, by the way, has a name, Hydrops. Okay, but it's not just about the overall size. The next clue is all about the state of the gallbladder's walls. They tell their own story, and they hold the key to figuring out just how bad the inflammation really is. And really, it all comes down to this one single number, greater than 3 millimeters. This is the single most common, most classic sign we look for on an ultrasound. So if you remember one number from this, remember this one. And this just lays it out so perfectly. Look on the left. That's a happy, healthy gallbladder. Its wall is nice and thin, less than 3 millimeters. But then look at the right. That's our inflamed gallbladder. It's swollen, it's puffy, all because of that irritation and fluid buildup. It's a night and day difference. But wait, the clues aren't just in the gallbladder itself. The whole area is kind of a crime scene, and the body is actively responding to the crisis. And with ultrasound, we can actually watch that response happening in real time. So our third clue is something called hyperemia. And to see it, we use this really cool feature on the ultrasound machine called Color Doppler. You can think of it like a weather map for blood flow. On a healthy gallbladder, you'd barely see any color. But when it's inflamed, whoa, the area just lights up, showing this massive surge of blood rushing to the tissues. Honestly, the best way to think about it is like the body's own emergency response system. It's making a 911 call, and it's sending every available unit, in this case, blood, directly to the scene of the problem to try and fight off that inflammation. All right, our fourth clue, this one's a little more serious. Sometimes the inflammation gets so intense that fluid actually starts to leak out of the gallbladder. And on the ultrasound, this shows up as this dark little pocket of fluid that's just hanging out around the organ. Yeah, finding this pericholecystic fluid is a really big deal. It tells our detective that this isn't just mild inflammation anymore, it's severe. And it can even be a warning sign that the gallbladder wall has gotten so weak that it might have a tiny tear or a perforation. The stakes just got a whole lot higher. So, let's recap. We've gathered all this visual evidence, we've got a swollen organ, thickened walls, extra blood flow, maybe even some fluid. But there is one more piece to this puzzle that can absolutely seal the diagnosis. So what is it? What's that one piece of evidence that can turn a strong suspicion into a rock-solid conclusion? And here's the interesting part. It's not just something we see, it's something we do. This is it. It's called the sonographic Murphy sign. And honestly, you can think of this as the moment our detective gets a confession straight from the source. The person doing the ultrasound gently presses the probe right over where the gallbladder is. And if the patient feels a sharp, specific pain right at that exact spot, that's it. That's our positive sign. It's a direct confirmation from the patient's own body. And the power of this sign is just undeniable. When you take a positive sonographic Murphy sign and you combine it with the other clues we've already found, like the gallstones and that thick wall, the accuracy of the diagnosis just skyrockets to over 90%. At that point, the case is pretty much closed. Okay, time to wrap this up. Let's put all the evidence on the table, run through our checklist, and make the final call. So let's just run down our diagnostic checklist, shall we? Gallstones? Present. While thickening over 3 millimeters? Confirmed. That all-important positive Murphy sign? You bet. We even saw that pericholecystic fluid and the hyperemia. I mean, with all of this evidence stacked up, the diagnosis is crystal clear. Acute cholecystitis. But, a good detective always ties up the loose ends. So, one final check is to look at the common bile duct. Think of it as the main pipe that the bile flows through. If that pipe is a normal size, so 6 millimeters or less, it tells us the problem is very likely contained just to the gallbladder. It's an important final detail. So there you have it, a full diagnosis, all figured out without making a single cut. It's pretty incredible what we can learn just by listening to the echoes of sound waves, isn't it? It really makes you wonder, what other secrets is the body hiding, just waiting for us to find the right tool to bring them into view?